Today's video is about obsessive compulsive and its related disorders. What I'm going to be doing is giving you guys an overview of what these disorders are and what they might look like to help differentiate when some of these symptoms that I'm going to mention are something that is just a little bit uncomfortable and when you may actually need to seek out mental health treatment for it. So if you're interested in this topic, definitely stay tuned. My name is Paula Sinisterra and I am a mental health therapist. And on this channel, I'm going to be putting out weekly videos for you guys covering a broad range of mental health topics to help empower you through knowledge and help answer some of your mental health questions. So in today's video, I'm going to be covering 5 obsessive compulsive and its related disorders according to the DSM-5. Right here with me, I have a desk reference of the DSM-5. This is a small version of a much larger book that is called the Diagnostic and Statistical Manual of Mental Health Disorders. And this book is basically what all your psychologists, therapists, and psychiatrists are using and referencing in order to classify different types of mental health conditions. So it's kind of like the Bible of mental health. I'm going to talk about the 5 basically top obsessive compulsive disorders that are listed in the DSM-5, which is the most current version of the DSM. It was published in 2013, and the disorders in here are grouped according to symptom similarities and according to neurological basis, right? So what we know is that there's definite brain similarities across these disorders, and that's why they're grouped together. So the 5 related disorders that I'm going to give you guys an overview of are obsessive compulsive disorder itself, hoarding disorder, trichotillomania, skin picking, which is also called excoriation, and body dysmorphic disorder. So the way that the DSM defines, explains, and classifies obsessive compulsive disorder is pretty much very similar to how it sounds, right? So it is identified by the thoughts, by the presence of either obsessions or compulsions or both. Obsessions are repetitive thoughts, images, or urges that we experience as intrusive, and we engage in different ways to try to block them or suppress them or neutralize them, right? And so the compulsions are the behaviors that we engage in to try to bring down the anxiety associated with the obsessive intrusive thoughts, okay? And you can have the obsessive intrusive thoughts and just engage in mental rituals to try to get rid of the anxiety associated with them without necessarily having to act on them. And another way that the DSM can classify when we are having just intrusive, regular intrusive, unwanted thoughts, which is something that everybody experiences, to when it crosses the line to being obsessive compulsive disorder, is differentiated by the amount of distress that it causes in people's lives and the amount of impairment that it causes in people's lives. So when you're getting to the point that you are spending hours a day basically being interrupted by the obsessive thoughts and the compulsions that go along with it, it's likely that's when we start differentiating it from, normal levels of intrusive thoughts and behaviors to something that is diagnosable as obsessive compulsive disorder. If you think that you might be experiencing this, and this goes for all the disorders that I'm about to mention and all the symptoms that I'm about to mention, seek out a mental health therapist to help you identify whether or not that's really what you're experiencing, okay? So that's obsessive compulsive disorder. If you want more details on that, I made a full-length video on that one alone that is already in my channel. So go check that out. I also include treatment methods for dealing with the obsessive compulsive thoughts and behaviors, and I also made another video just for anxious and obsessive thoughts, so you can check that out. And those are going to be good for any of the other obsessive compulsive disorders, related disorders that I'm about to mention. Next up, let's talk about body dysmorphic disorder. So this is different from being a little bit insecure about our bodies, and it goes into excessive preoccupation with one or more perceived flaws, physical flaws in ourselves that might appear only like a slight flaw or might not even be noticeable by others, but we are completely obsessed with it, okay? And this is accompanied by behaviors, repetitive behaviors, or mental acts that individuals engage in to try to neutralize or somehow manage and deal with the distress around their perceived flaws or appearance. So some of the repetitive behaviors that people might engage in include like repetitive mirror checking, grooming themselves all the time, even picking their skin to try to maybe get rid of defects on their skin can be a behavior associated with this. Some of the mental acts that people definitely engage in could be like mental comparison, right? So just, going into spaces and immediately comparing ourselves to everybody around us to see how we measure up according to the way that we look. Or we might engage in obsessive reassurance seeking from others, maybe asking for constant affirmation that we do or do not look a certain way, that our perceived flaw, is or is not that bad, and just being obsessive about it. Something that is common, just like I've explained in the Obsessive Compulsive Disorder video, is that these behaviors and repetitive mental acts that we engage in do not actually bring down the distress. They actually feed into our belief of the perceived flaw. Now, when it comes to body dysmorphic disorder, they've done research that there's plenty of research that is suggesting that there is brain differences in the way that people with this disorder look and see themselves. The more that they focus on individual flaws in their body or on their face or wherever it is, they become hyper fixated on that part of their body, and either their brain is already kind of wired like this, or it gets wired like this in the sense of getting wired into becoming so obsessed with one particular body characteristic that it can no longer see the whole picture of what they are looking at, right? So when other people look at us, they see the whole picture of who we are. They see the entire composition, so to speak. When we're struggling with body dysmorphic disorder, we might, for example, not like the way that our, maybe like our hairline, I'm just coming up with something, right? The way that our hairline is, or maybe the shape of our nose, and we might become so fixated on it that because we are only looking at that every time that we look in the mirror, it starts to appear worse and worse and out of proportion to the rest of our face or our body, because we are no longer looking at the big picture. And so what they've noticed in some of these studies is that people with body dysmorphic disorder there's a pattern of not being able to look at whole pictures, but rather like getting really in on the details, right? So that's why like minimal flaws might become so big and like all encompassing for people that are experiencing this disorder. Now, once again, it goes beyond just being physical insecurities when the preoccupation with the perceived flaws becomes so large that it starts to interrupt and significantly get in the way of our ability to function in life. It keeps us from going to social gatherings. For some people, it can keep them from going to work, just avoiding any kind of situation with other people, severely aggravating any kind of symptoms of social anxiety. It can even cause symptoms of depression, just like with any of these disorders. But that's basically a quick overview of body dysmorphic disorder. I'm gonna do a later video to get into more details about it so I can take you guys deeper into it and explain some of the ways in which it's treated. So next up, let's talk about hoarding disorder. So hoarding disorder is basically characterized by significant difficulty and distress in parting with physical possessions, regardless of their actual value. And this is accompanied often by this persistent perceived belief that they need to that these possessions need to be held onto and saved, or difficulty discarding them, even to this can show up as feeling like they need to be discarded in the perfect way, or they need to be given to the perfect person. And all these things end up coming together in such a way that possessions begin accumulating and accumulating and accumulating for the person that is experiencing hoarding disorder. They could be hoarding anything. Like I said, it's regardless of the perceived value of the object. It could be newspapers, it could be paper, sometimes it's trash, sometimes it's, you know, it could be anything, literally anything. But it's a hoarding disorder when it starts to really just the possessions begin accumulating, and it gets to the point for people that they have difficulty moving around their house, they cannot invite other people over. It basically becomes a serious functional impairment to their living condition. And even when this is happening, the person still experiences significant distress and difficulty in letting go of these possessions. Now, this can also be accompanied with excessive acquisition. So in addition to not being able to let go of possessions or having a really hard time discarding of possessions, the person might also be experiencing an obsessive or a compulsive need and behavior of acquiring more and more objects that they don't actually need and for which there is no actual space. So the problem just keeps growing and growing. That is a quick overview of hoarding disorder, and I will also do another video on that to get into more details with you guys and to talk about the treatment. But as you can see, it also follows that very much like obsessive and compulsive pattern as the other disorders that I have mentioned. In this case, focusing on material objects, holding on to them, not being able to let them go, or not knowing how to get rid of them, and feeling like we need to keep acquiring more even when there is no space. So the fourth disorder that I'm going to talk about with you guys is trichotillomania. Trichotillomania is repetitive and compulsive hair pulling. And this is something that causes a lot of distress, just like all these other disorders that I have mentioned. And it is characterized by this compulsive and recurrent hair pulling. It can be hair anywhere on our body. It could be our eyebrows. It could be our eyelashes. It could be the hair on our head. It could be hair anywhere on our body, literally. And the person feels significant discomfort until they engage in the hair pulling behavior. It doesn't need to make sense. There is no rational reasoning for it. This kind of obsessive compulsive disorder is very just repetitive and motor and automatic, and our body almost just starts getting trained into our hands immediately going to pulling out the hair. Oftentimes this happens when anxiety or stress is increased. For all of these disorders, any of the symptoms that are associated with them, the symptoms are magnified when anxiety and stress increase, okay? So in stressful situations, somebody with trichotillomania will probably find themselves pulling out more hair or engaging more compulsively and repetitively in that behavior. It could also happen just automatically, for example, when the person is bored in certain situations, right? Like some clients really struggle with doing it when they're in the car or when they're at school and they just have to be sitting there with nothing to do. And a lot of times treatment, something that helps people is having something to hold on to just to keep their hands literally busy. It's a very physical type of compulsion. So finding ways to keep our hands busy can be really helpful. Mindfulness is really helpful. And yeah, so that's trichotillomania, and that's another related disorder as well, okay? It can end up causing significant bald spots and, either on our head, on our eyebrows, or even losing our eyelashes. And as you might imagine, this causes a lot of shame for clients because not only, are there these social norms about hair, but there's the second layer of feeling like we're doing this to ourselves and not being able to control can really produce an increased amount of shame around it. So that is trichotillomania. The fifth and final disorder that I'm going to mention today is excoriation, which is skin picking disorder. And this is very similar in nature to trichotillomania, but it's focused on skin. And it is repetitive and compulsive picking at the skin to the extent that it causes lesions in the person's skin. And this can get dangerous too, because it can, these lesions are, open wounds that can end up becoming infected. So it's also highly distressing for clients. A lot of times, a lot of these disorders can show up, together. A person might experience it at different times, just because they are all so related to having that kind of obsessive compulsive type of anxious brain. But so back to skin picking, it is also something that you're not able to stop doing despite repeated attempts to stop, right? So it kind of feels like it's out of your control, and it's not better explained by some kind of drug use or another type of disorder. Okay, so that is excoriation, and it's another disorder that also fits within this group of associated obsessive compulsive disorders. So that was just a broad overview for you guys of obsessive compulsive and its related disorders. I mentioned 5 disorders here today. Of course, the obsessive compulsive disorder itself, trichotillomania, the hair pulling, excoriation, which is the skin picking, hoarding disorder, not being able to let go of objects, and excessive acquisition to the point that it significantly impairs our ability to live in a healthy and quality way, and body dysmorphic disorder, where we become so preoccupied with one or more perceived physical flaws that it significantly interrupts our life and our functioning and our ability to just be present and interact with the world. All of these disorders can definitely lead to symptoms of depression. That's something that can often happen comorbid, meaning at the same time with them, because as you can tell, or as you might imagine, there's so much distress that goes along with experiencing this. So again, if you guys think that you might be experiencing some of this, I'll encourage you to seek out mental health treatment. Exposure response prevention is going to be one of the most important types of therapies that you can engage in for any one of these, and that is part of cognitive behavioral therapy, but specific in the sense that you're being exposed and to the things that trigger you and refraining from responding in the way that you usually do. This is how we start to break the patterns in all these disorders. And just so you know, and there is hope, significant research to show that brains really do change in response to treatment. So there is help out there. You don't have to go through it by yourself. If y'all have any questions, comment below. And if you're interested, subscribe so you can be notified as I make more videos getting more specific into each one of these. Like I said, the obsessive compulsive video is out. I may get even more specific with that one in the future as well. But yeah, as always, thank you for joining, and be kind to yourselves.